The surgery begins with a small incision being made at the corneal limbus. That's the border between the cornea and the sclera, the white part of your eye. From here, a corneal tunnel is made. This gives access to the anterior chamber of the eye. The anterior chamber is the fluid-filled space that sits directly in front of the iris and the lens. Now, a fluid called a viscoelastic substance is injected into the anterior chamber of the eye. This is to prevent the cornea from sagging or collapsing during surgery. Next, a few small incisions are made to allow for insertion of some other tools that will be needed during your surgery. The capsule surrounding the lens of your eye is now opened using a technique called capsulorhexis. It may be helpful to think of the lens as an M&M. Where the eye has a capsule, the M&M has a candy shell. Once you make a small incision, you now have access to the contents. In the case of an M&M, chocolate. In the case of your capsule, your lens. In a process called hydrodissection, a fluid is injected under the lens capsule. This helps separate the lens from the capsule, making the lens easier to remove. Now, the process of phacoemulsification starts. Here, the phaco tip is used to dig deep grooves in the lens until the lens is actually cracked in half. Then the lens is spun and cracked into fourths. With the lens now broken up into 4 manageable chunks, the process of emulsification and aspiration take place. This is basically just breaking up the lens and sucking the pieces out. Relating back to our M&M analogy, much care is being taken here to not break the candy shell, in this case, the lens capsule, which is very delicate. Using the irrigation tip, one last sweep is made to make sure that all leftover fragments are picked up. Again, a viscoelastic substance is injected to fill the space left in the capsule bag after the lens was removed. This allows for placement of the artificial lens. One of the original incisions is now made just a little larger to allow the artificial lens to be placed. Now, the artificial lens is folded. This allows it to slide into a smaller incision than would normally be needed. With the lens now folded, it's ready to be inserted through the incision. The lens is then positioned so that the arms are facing the inside of the capsule. The lens is then allowed to unfold, the arms and both the lens are then pushed into the capsule. With the lens now in place, the viscoelastic substance is then sucked out, allowing the capsule to form snugly around the lens. All the incisions made are self-sealing, so no stitches are needed.